videos. If you are sharing anything with video, just take note to include your computers down on. Yeah. Okay,
Right. Is
take it
this
away.
okay? Give me a minute to load the page. All right. Can you guys see this?
Yeah, it looks great.
Yeah. Okay. So hi guys, I'm Shannon, and today I have Kenneth and Allison with me, and we are all year 4 medical students from UNSW. So we'll be going through the curriculum of UNSW medicine, as well as how our society, the Singapore Medical Society of UNSW, helps our Singaporean students prepare for the whole 6 years, as well as some activities you can participate in as a medical student in UNSW. Right. So first off, okay, let's start. All right. So UNSW is a 6-year course with 3 different phases. There is 2 years per phase, and the emphasis is on developing an all-rounded student. So solid foundation in your medical knowledge and good patient communication skills and interaction, as well as hands-on clinical experience from even just first year, right? So in phase 1, which is year 1 and 2, we have weekly lectures, tutorials, and practical classes. And phase 1 consists of 8 courses with 10 weeks, so approximately 2 months per course. And each course focuses on a body system, for example, the heart or the brain or the lungs. And within each course, we have fortnightly hospital sessions, probably about 3 to 4 hours for each session. And these sessions focus on building patient interaction and history taking skills. So you actually get the chance to shadow a senior doctor around in groups of about 4 and 5, and also to actually talk to patients, take a history from them, as well as even practice your clinical skills. And in phase 2, um, in year 3, students get to go to hospitals 3 times per week, and this would be for the entire day instead of just for 3 to 4 hours. And you will shadow teams to interact with patients, as well as even have the opportunity to observe surgeries, as well as practice skills such as cannulation or intubation. And the emphasis of this is to strengthen and build your clinical skills, as well as help to mold you into a more well-rounded and confident student or future doctor. And we have 2 weeks on campus as well, where you will build on your medical knowledge, as well as knowledge of different conditions, as well as how to treat these conditions. In year 4, you will get an entire year on research, either an independent learning project or the chance to upgrade this to an honors project. And there's a vast variety of possible research projects and supervisors that you can choose from. You can choose a project which you are interested in. For example, I'm doing something on cardiology, and your friends can be doing something on surgery or just something on the brain, or even just social projects. And yeah, so in phase 3, the year 5 and 6s are full-time hospital students. They'll be going to hospitals 5 times a week and assisting doctors with simple medical procedures. Our seniors can also assist in surgeries, for example, helping the surgeon to hold different medical instruments, as well as maybe even hold the entire fracture clinic themselves. So they would take a history from the patient, jot it down in a book, assess the patients, perform physical examinations as well, and report back to their supervisors. And this aims to complete the transition from medical content to actual clinical practice. Okay, I think we'll pass the time on to Allison, who will bring you through how our society can help you in UNSW.
Yep, so we are all representatives of the Singapore Medical Society of UNSW specifically, and this is quite a large society, as about half of all medical students, half of all international medical students in UNSW are Singaporean. So we do have quite a strong peer mentoring system involved, where every first year student is matched with a senior student for at least the first half of the year. So they get support academically, they get support in terms of transitioning and actually moving into Australia. We also run a lot of academic tutorials by seniors and a lot of other briefings as well. So we just actually held a welcome briefing for the incoming year ones of this year, where we just told them a lot of information about who they can seek for help, the type of notes that are available online, as well as some of the resources that they can get to supplement their academic journey as well. Our society also organizes a lot of volunteering opportunities. We had blood donation drives over the holidays recently. We also do a partnership with Elder Care Centre in Australia itself, where our members go down on a weekly basis to befriend the elders as well as carry out simple tasks to just help the nuns in the Elder Care Centre there. We also have some links with the UNSW Medical Society itself, and the UNSW Medical Society also does quite a fair bit to support their students as well. They have their own tutorials as well. They also have a separate mentoring system. However, that is in a large group setting rather than a one-to-one setting as what SMSUNSW would do. And there's also a UNSW Medicine Wellbeing Officer who is always available to meet up in case any of you have any emotional concerns, as well as academic concerns, such as you're thinking you might not be able to continue the year or you need to take program leave and stuff like that. Yeah, so there's a huge variety of welfare and support, and being such a large society, we do have quite a fair bit of knowledge as to how we can best help each other progress through the year. Yeah. So I'll pass the time on to Kenneth, who just start explaining a bit more about the different experiences that you can get at UNSW.
Thank you, Alison. I would like to now talk about several interesting experiences I have had since starting medical school. Instead of talking about the amazing beaches, costume parties, and social activities, I'll be focusing more on experiences that are exclusively for medical students, as I believe that SSA, the Singapore Students Association, will be covering that more in detail. Broadly speaking, most of my experiences as a medical student in UNSW has come from one of these four categories. The first being MedSoc, which is a student association for UNSW medical students, and the different events that are organized by them. I'll be talking more about them in the next couple of slides. Secondly, there are other societies such as the Rural Allied Health and Medical Society, RAMS, which are more specialized and target staff such as rural health. So every June, they will organize a 3-day trip down to Dabo, which is a rural part of Australia, and perform examinations on the ears of children, as that's like the most likely age for them to get an ear infection. And when I mean rural, I don't mean like Choa Chu Kang or like Tampines or like Gedong. Like these places are like 400 km away from Sydney, and they require driving up to like 5 hours to reach a destination. Although I personally didn't participate in this, I've been on other road trips before, and let me just put it out there, these road trips are one of the best experiences of my life. When I went down to Nelson Bay, we went to this really remote area, which is basically like the mouth of a water drainage basin. And we saw dolphins there for free. People pay to do that. And I thought it was very interesting. Thirdly, you may participate in a conference as a participant or a presenter. Shannon will be talking more about a conference that she organized for people to participate in later. But as a presenter, as Shannon mentioned before, in the year 4, you'll be doing like an independent learning project, which is where you take up a research project and you work on it. If you put in enough effort, you can be invited to like, other countries or like maybe just within Australia as well to like present your research project and the importance of your findings. So while I haven't completed my year 4, I've had a senior who is now an intern who flew to Netherlands to present her project. So lastly, there are overseas medical missions whereby you can actually utilize the medical knowledge you have learned over the past couple of years to help people that actually need it. Next slide. Yeah, in fact, I would say that my time in Battambang, which is a part of Cambodia, was definitely the highlight of my medical school journey thus far. In this 8-day medical trip to Battambang, the main objective was to help the villagers that, due to the remoteness of where they stay, were limited in the amount of medical attention they could seek. We will spend the first couple of days packing the medications we will be providing these villagers, then spend the next 5 days going down to different remote areas where we will consult villagers that needed help. As you can see on the top right picture, we would like set up tents and several tables where we had actual practicing doctors to consult these villagers that had medical issues. Whereas what we were doing, we would be providing the medicine, like we'll be the pharmacy, we would be like guiding people where to go and doing the triage stuff. So as you can see in the next picture, that was our makeshift pharmacy. We would had to provide the correct dosage that was prescribed by the doctors and explain to the villagers how to consume these drugs. For example, was it once a day, twice a day, before meal, after meal, or whether like the antibiotic bottle had to be like shaken well before consumption. So apart from like the medical stuff, on the days that we didn't have clinic duties, we would be placed in other roles such as food delivery team. Personally, for me, I was part of the food delivery team. We were sent to like different villages that were very remote. Like one was across a river, so we had to get on a boat to pass the food to them. So like what we did was we gave like bags of rice, bottles of cooking oil and stuff, and we ended off with a dinner and a performance night, which you can see on the bottom right, where we danced for the villagers. I personally felt that this experience was an enriching and really fulfilling one. It was not just the fact, previous slide. It was not just the fact that we were helping someone. It was the fact that I could put my medical knowledge to the test. Like on one of the days whereby the clinic was flooded with like on one of the days where the clinics were flooded was flooded with villagers, we didn't have enough blood pressure machines to triage to screen the patients. So what we had to do is we had to take out our stethoscopes and like manually measure their blood pressure ourselves. It was something that we learned in medical school that we didn't really get to like do on real patients. We've only done this on like simulated patients in the hospitals and in the school up to now. And like for the doctors to trust us to do this examination and trust our how we did it, I felt like that was really fulfilling to me, because it finally felt like we finally did what we came to medical school to do, which was to help people. Personally, if COVID hadn't struck last year, I would have definitely attended it again. Next slide. So now moving on to the MedSoc event that I talked about previously, one of the events that I had a lot of fun in was the suturing night. In this event, there will be seniors from SMSUNSW, which is another specialized group under MedSoc that have a lot of experience in surgery, coming down to teach different suturing methods. Based on the proficiency level, you could either sign up for the basic suturing one or the advanced one. I personally only attended the basic suturing course, where they taught us basic techniques such as like the simple interrupted and mattress techniques. They would pass you like your pig skin, which had like an incision cut with like a scalpel, like as you can see on the picture there, and along with like the other equipment we needed. So like what this person's holding on the right hand was the needle driver, which was what you used to drive like the string along the suture along the incision. So after the course, they gave us the equipment set to bring home to practice it ourselves. Of course, we had to buy our own pig skin, which I never really got around to doing. But we had seniors who bought like pig meat, which they practiced on, right? And then they used it to make pig trotter after that, which is quite cool. So next slide. So another event I attended was the birthing kit night. Now it wasn't a very exciting or very fun event, but it was a very heartwarming event. So as you may or may not know, there is a large proportion of women in developing countries that deliver at home due to the inability to afford hospitals. Even in hospitals, some of these hospitals may be lacking the necessary equipment, such as a clean scalpel or antiseptic solution. So what we did in this event is that by spending a bit of money, we were able to purchase like the necessary equipment, which we then packed into what we call a birthing kit, and we sent it over to these developing countries to try and improve the delivery situation, and for the pregnant mothers not to encounter any complications that could endanger their lives. Of course, there are many more exciting activities that are available to UNSW students, but these are just the ones that stayed with me and I wanted to share with you guys. Also, like I said before, my life is not just limited to medical stuff, but for the purposes of this sharing, this is what I stuck to. So Shannon will now talk about a conference that she organized.
So I was part of the critical care conference organizing committee, And we focus on bringing awareness to situations such as emergency departments or trauma, or even just rural trauma situations. And as part of this conference, we invited many award-winning physicians as well as trauma surgeons and experts to come and give a talk and share their experiences as well as the process of being a consultant or just rising to their current position. We also organize many different breakout rooms, such as a ultrasound workshop, as you can see on the bottom right-hand side, and intubation workshops, where we have actual doctors as well as specialists who will come down to UNSW to teach our students and let them actually practice on live models. We also have suturing workshops as well as ophthalmology workshops. So this is just a very small example of one of the conferences that's held by a society in UNSW. In any given year, we have maybe about 3 to 4 different conferences, or even more than that, organized by many different societies, such as your Internal Medicine Society, your Dermatology Society, as well as your Search SOC. Yep. So these conferences provides you with a very good opportunity to actually interact with distinguished physicians as well as hear their experiences, and also practice your clinical skills as a year 1, 2, or all the way to year 6 if you want to attend. Right. So, yep, this will be Alison.
Yep, so I participated, one of the many societies, I participated in this Aboriginal Heritage Tour. I think something unique about Australia is that they have a very strong Aboriginal emphasis in their education system. It's something that I think not a lot of countries choose to emphasize, but Australia has made it part of their curriculum about learning about the native language of the land that you are currently in and stuff like that. So one of these activities organized by the Medical Society was an Aboriginal Heritage Tour in collaboration with the local Aboriginal group where we were. So this was La Perouse. It's an area very near the university, and we just went on a tour of the bushland, discovering the local fauna and flora, as well as introducing why the land was so significant and so special for them. Yeah, and besides the Aboriginal Heritage Tour, another society that I was part of was the it's called Med Show. I think it's the next slide. So this is more in relation to the performing arts side in UNSW Medicine specifically. So there are 2 big performing arts scenes in UNSW Medicine. One is Med Show, which is an annual charity musical. There's band players, there are dancers, singers, actors. You even have like tech directors, so people who are behind the scenes, backstage, operating the lights, the sounds, moving equipment around, as well as the Medical Music Society, which has both vocal, like a cappella components, as well as orchestral component to it as well. Both of these have regular practices. However, Med-Show has one large performance at the end of the year, and the Medical Music Society has multiple smaller performances throughout the year, and there's a more it's a more regular interest-based society with people who just love music. Yeah. So I think all of us have had very different experiences. If you ask any of us questions about our experiences in UNSW Med, they'll be very, very different. But I can say that UNSW has done very well in trying to provide a very holistic education for all of us. And we definitely go out of UNSW Medicine, not just being academics, but really being all-rounded individuals. Yeah. So that's the end of our presentation. If you do have questions, please ask. I do see one question here. If I just start the Q&A, says how many foreign students intake per year was the minimum IB score as well as ISAT scores that are needed to apply to UNSW. From our experiences, I think every year they do take in a different number of foreign students per year. Singaporeans alone generally range from about 30 to 40, sometimes even more than that, going up to 50 students a year. I can't say for the exact number of overall international students because the university doesn't disclose that, and it does change from year to year. With regards to minimum IB scores and ISAT scores, I do believe that there is no fixed minimum. I think there is a recommended, but they do take both scores into account. I know students who have very strong IB scores and not so good ISAT scores who have gotten into UNSW, as well as students with the other way around, with not as strong IB scores, but very strong ISAT scores as well. Yeah, but maybe I think Cheryl can give a bit more information.
Yeah, I'll chat about that in a bit. Maybe okay, just give me a second. We do actually have the international quota. I'm not at liberty to reveal it right now. I actually have a document that we went through in detail last Saturday, because we actually went through all the the quota, the international admissions, the IB score, the minimum ISET score, and things like that. And then we went through sort of the admissions process, particularly for UNSW. UNSW follows a rolling admissions process. So as long as you've hit that threshold that our counselors have, the threshold that the university has set for ISET scores, then you'll be given an offer for an interview. After you sit for the interview, you'll then be able to they'll collate your interview scores and your academic scores, and then they'll see that it falls within their range that could be eligible for offer, and then they'll issue it out already. Yeah, so thank you, Sun-Chu, who's our regional director here for at UNSW for UNSW. She's actually answered your question about the minimum IB score and number of places for international students. But of course, that's the international quota. As Alison has said, that of course, but there isn't a certain amount that gets allocated to certain nationality. Like, there isn't a cap for Singaporeans or so. International meaning everybody. Yeah. So yes, definitely chat with your counselor, and they'll go through that whole process with you. Our session last week was so good. We actually had more members of the SMSUNSW show up. President, the previous president, and the incoming president, and they also shared their insights about how it was like studying a little bit of virtual, a little bit of physical, and how how they what sort of tips they could give on acing the admissions process and acing the program. So that was lovely. We should actually get you guys in for the next session, and perhaps you could stay in touch with us and we can show you a recording of that session. We also had a test prep session with our partners, actually giving some information about how you can ace the ISET. So we'll definitely think about organizing another session like that, maybe in March or so. And then we'll love to keep in contact with us, keep in contact with your counselor, and then we can get you in for that session as well. Okay, let's see. What other questions are there? Okay, we've got quite a few questions. Students, if you could just put the questions in the Q&A and not in the chat, then we can have like a more consolidated place to look at all those questions. Okay, let me just scroll down. Go. Okay, there's that. All right, open question. 6-year program, including house surgeon or not? I think what they meant was housemanship year. That doesn't include the housemanship year. Yeah. All on board on that answer. Okay, fantastic. Yeah. Thank you. House surgeon will arrange by university or by yourself. If you're referring to the housemanship year, that's arrange yourself, right? I'll let you guys answer that one.
I think for every university it's the same. So housemanship is not included in any uni's 5 or 6 years program, and it's always arranged by yourself.
Yeah. It's actual, once you hit your housemanship year, you're considered a full accredited doctor. So that's the start of your working career. You find your job by yourself. Yeah.
Okay, what is the deadline for medical applications? Right. Okay, Mr. or Mrs. A, I would definitely ask you to hop onto our main virtual room, so you can speak to the counselors over in the team, over in the IDP counseling room. They've got a full document that has literally listed everything out: your minimum entry requirement, your deadlines to apply by, what your minimum ISET scores should be, or rather when's a rough deadline for the interview, that sort of thing. And I definitely would recommend that you either contact the counseling team on our virtual counseling service on our website, or go onto like just come to the office to speak to a counselor and sit down with that document, so they'll go through school by school what that process is, because it gets very detailed, right? I think if any of you have gone through IDP before, you know there's really like you plan a year ahead, and you get a sense of like which university is going to come out with offers when. So definitely recommend you do that. Now, another question about the student experience, I think. Hi, I'm wondering about how much stress you guys feel throughout all the years from year 1 to year 4, and how are you guys able to cope? Is there enough time to manage everything well? Okay, feel free to also like talk about, a week in the life of a med student. Yeah.
I think I can answer that.
Yeah.
Personally, I feel that the Australia like study culture is already much more laid back than Singapore in general. So like I feel like if you are going through like A levels right now, like and you are like coping well with it, I don't think you have that much to worry about like medical school in Australia. I can actually kind of like talk about what like a week kind of is like in UNSW, especially at the first 2 years, because like we are only like starting year 4 now, so we can't really talk about the other years. But at least for the first 2 years, what our week usually goes like is we have like lectures from 9 to 11 each day, and depending on like whether you have practical classes or tutorial classes, it can go from, so after 9 to 11 you have like a 2-hour lunch break, and after that you can either have a 2-hour class or a 4-hour class afterwards. So what I personally feel is that I have quite a good work-life balance, because most things end by 5 p.m. latest in Australia. So after 5 p.m., you're more or less free to do whatever you want. Like you can decide to study and like just keep up with the work that you have been assigned, or you can like join like sports clubs. I'm part of the UNSW rugby club. Alison spends her time after 5 p.m. dancing. As she mentioned before, she's part of Med Show. Shannon like organizers like activities such as the conference. So we do have a very good work-life balance in UNSW. As for stress levels, definitely I do feel stress at certain times, but I would say it's very well balanced. Like it's a good amount of stress, the kind that gets you to improve yourself. So usually you have an exam at the end of every 8 weeks. So as long as you pace yourself and you study hard like throughout the 8 weeks, I feel that it's not that bad once you come to the exam period. And plus you have like usually you have a 5-day break before like the examinations actually start. So you can even use the 5 days to catch up. So I don't know if Shannon and Alison has any other experiences.
That's a really good one. Yeah. And you
Yeah.
guys find time to, be in a society, right?
Well, I think UNSW has a large variety of clubs and societies, and they are all, generally in the evenings or on the weekends. And the med school timeline, if you do plan out your studying well, you have time to participate in all these other extracurricular activities and other interests that you might have. Yeah. And they do encourage it, actually. Yeah.
Brilliant. We just have to hurry along a little bit, as I know our next speaker has already arrived, but we would just like to get through maybe one or two of these other questions. May I know what are the available scholarships?
There are no undergraduate scholarships for international medical students. The only so-called like scholarship you might be able to get is the pre-employment grant that's applicable from year 4 all the way to year 6. And that one, we're not sure if it's going to be offered every single year. It's up to the Singapore government as to whether they want to offer it to Singaporeans every year or not.
Yes, but none from the university side.
None from the university.
Yeah, that's right. Okay, and then let's do another one. How difficult is it for Singaporeans to find housemanship in Singapore?
I think again, it does vary on how many positions Singapore wants to give international students, and international students meaning people from any school that's on that second register of schools that are accepted in Singapore's working system. Yeah, so can't answer exactly how difficult it is, but I don't know any Singaporean medical student who has not been able to find a job at all. Yeah.
Got it. There's another question about the A-level entry requirements. I may also, I think I'll answer that one. Preliminarily, UNSW Australia requires 22 points for the Singapore A-levels. If you come from the UK A-levels, it's a bit different. Check with your counsellor on that. Now that 22 points, how you calculate that 22 points is 3 H2s plus 3 of your H1s, your best H1s, and 1 H3. If you have additional H2, like you're a student who's done 4 H2s, you can add on that additional H2 and that H3 subject. Now, how you calculate it is, like you've already said, so Benjamin, A is 5, B is 4, C is 3, and all that. So you just need to total all that up according to the computation that I've told you, and then make sure you've hit that 22 points. That's the minimum that allows the application to be on the table. But don't worry about this, because your counsel will show you this document, and then yes, they will calculate that for you as well, so you can always verify. The IB score, I see another question there, that's 38 points. H3 is not compulsory. You don't have to have that. Most students now don't really do the H3s, you just do H2s and H1s, but make sure that you have it's just that if you do happen to have additional H1s or H2s, you can actually include that. That is the maximum number of subjects that we can include for computation. Okay, please don't worry about it. Your IDP counselor can sort that out with you. So all you have to do is stay in contact with your IDP education counselor and show them your transcript or where your grades are at the moment. If you're a J1 student, you're not tracking so well, that's fine as well. We can have a solution for that too. So just stay in contact with us. All right, I'm aware of the time. So guys, thank you so much for this. I really, really appreciate that. If you guys have any more questions for Kenneth, Shannon, and Alison, please hop on to our virtual chats or check in with Unsw, who's over in our virtual rooms, or the IDP counselors, and they will connect you directly, or they'll answer those questions as well. All right, are we pretty much done with all the questions? Great, fantastic. Thanks, guys. Really appreciate it so much. That was a fantastic presentation. I'll look forward to getting a copy of those slides from you. Thank you. Have a great rest of your Sunday.
Thank you for having us.
Thank you.
Bye. Bye.